all throughout Donald Trump's campaign, he was screaming blue murder about Hillary Clinton's going to cut your Social Security and Medicare. Meanwhile, he's been stating that nobody is going to touch your Social Security or Medicare if he's elected president. Well, was he lying? Or does he not know that the person that he is nominating for Secretary of Health and Human Services is an avowed opponent not only to Obamacare, which, you know, that's the Republican mantra, but he also wants to reduce or get rid of Medicare, and he also wants to chop down Social Security. So I'm kind of confused. You're saying one thing, but you're appointing people who have the exact opposite viewpoint of what your policy statement indicates. Check this out.
That's it. War on seniors. That's what you're going to be hearing from Democrats like Chuck Schumer all year next year if Donald Trump abandons his campaign pledge not to cut Medicare or Social Security. If you're on Medicare or Social Security or Medicaid, or you benefit from the Affordable Care Act, you have every right to be worried about what the Trump administration is going to do to those programs. Donald Trump's nominee for Secretary of Health and Human Services, Congressman Tom Price, has called for a repeal of the Affordable Care Act and is on record supporting the repeal and replacement of Medicare. Congressman Price has introduced legislation that would allow individuals to opt out of Medicare. And he is a longtime supporter of House Speaker Paul Ryan's plan to convert Medicare to a privatized system, which Paul Ryan calls premium support. Here's Congressman Price defending the first and most extreme of the Paul Ryan budgets in 2011.
We've got to have something different than business as usual. And part of that whole discussion means that we've got to address the issues of Medicare, Medicaid, and Social Security, which is what our budget did, which is what the Republican House budget did in a very positive way in the area of health care, allowing seniors after those over the age of 55 are allowed to keep Medicare. Those under the age of 55 would move into a program that allows them to select the kind of coverage that they want for themselves so that patients and families and doctors can make medical decisions and not the federal government.
Joining us now is Stephen Brill, journalist and author of America's Bitter Pill, Money, Politics, Backroom Deals, and the Fight to Fix Our Broken Healthcare System. Also with us, Dr. Ezekiel Emanuel, Chair of Medical Ethics and Policy at the University of Pennsylvania and one of the authors of the Affordable Care Act. Steve Brill, the threats to the various beneficiaries in the healthcare system under the Republicans in the House are quite serious and have been known, but we had this Republican candidate win the presidency saying absolutely will not cut Medicare, won't cut Social Security, but will repeal the Affordable Care Act. What should people be expecting? What should they be worried about?
Well, Tom Price never got that memo. What he did get were hundreds of thousands of dollars of campaign contributions in his last election, the one that just happened, where he was running virtually unopposed. His opponent raised $8,000. He raised $2 million. The three top industries that contributed to his campaign, hundreds of thousands of dollars each, were, guess what? The pharmaceutical industry, the insurance industry, and various doctors groups.
Now, just in case you didn't know it, as far as Medicare is concerned, they do not have the ability to negotiate drug prices. Why? Because when Medicare was created, the pharmaceutical companies came in and contributed all kinds of money to Congress in order to get that written in that there could be no negotiation on drug prices. And they're still kicking in because they're making billions of dollars on overinflated prices for pharmaceuticals in this country, whereas all you got to do is go across the border to Canada with a prescription if they honor it, and the cost of medications there are at least 50% cheaper. Have any of you guys ever gotten those spam emails for Viagra and other pharmaceuticals and how cheap they advertise their prices. Well, those ads are real, okay? And the reason that they can come in with Viagra, I guess, at, trying to remember, I think it was like $10 a pill or something like that, $5 a pill. The reason they can come in so cheap is because they're getting it from across the Canadian border.
He is the author of an effort to stop a CMS, that's the Medicare agency, an experiment that they were empowered to try because of the work that Zeke did in the White House that would lower the cost of cancer drugs by taking away the incentive of hospitals and doctors to prescribe the most expensive cancer drugs. He is leading right now in the House the effort to block that. Once he gets this job, he doesn't have to lead any effort at all. He can just block it on his own.
Zeke Emanuel, what do you see developing in the Trump administration, given the campaign promise, never going to cut Medicare, never going to cut Social Security, we are going to repeal the Affordable Care Act and then replace it with something terrific?
Well, I think at the moment, all you can say is that there's a lot of uncertainty in which direction they're going. How much Representative Price will speak for the president is unclear. The president, I think, has genuinely said he's committed to getting all people who have coverage and in making sure that they get it. At various points on the campaign trail, he said he likes Medicare, he wants to keep Medicare, and he wants to make sure that we have universal coverage in this country. He's even talked about Medicare negotiating drug prices. How this pick of Representative Price matches those policy statements he made, I think it just makes it unclear which way we're going. And, you know, disagreements among the Republicans about how to replace Obamacare have been quite common. We've never really gotten a coherent plan. So we'll just have to see. I do think that may create an opening for negotiation with President Trump.
And I think it's unlikely that Donald Trump asked for some briefing on exactly how much he disagrees with Price on what before he was chosen. But let's show how much he disagrees with him. Let's listen to Donald Trump, the candidate, on these subjects.
They're attacking Social Security, the Republicans. They're attacking Medicare and Medicaid, but they're not saying how to make the country rich again. People have been paying in for years. They're going to cut Social Security. They're going to cut Medicare. They're going to cut Medicaid.
Right.
I'm the one that said I'm not going to do that.
I am going to protect and save your Social Security and your Medicare. You made a deal a long time ago. A long time ago. We're going to save and protect your Social Security and Medicare. And Hillary is going to cut your Social Security and really injure Medicare. That's what's going to happen.
We're going to save and protect your Social Security and Medicare.
I don't think he knows what those programs are. He for sure doesn't know what Medicaid is, because he said there, you've paid into Medicaid.
Right.
And Medicaid, people don't pay into it. It's
right.
for poor people. He does not know what he's talking about. I'll tell you what he does know. In the financial disclosure statements that he had to file, such as they were, he did have to list all the stocks he owns. The largest group of stock he owns are the drug companies, 11 of them, including the maker of the $1,000 hepatitis C pill. Now, that's not an issue with selling off real estate. He could easily put those stocks into a blind trust. All that money is liquid. He hasn't even done that, and he has this obvious conflict of interest, and in appointing Tom Price, he's picked the guy that the drug companies love the most.
Zeke, what are the Republicans going to run into now that they actually are in a position to repeal Obamacare? They've got a president who would sign a repeal of Obamacare. They've never had to face the reality of repealing Obamacare before. They just got to do their gimmick votes. What's the difference for them now? What will they discover about what might happen if they do that?
Well, if you repeal Obamacare, it's very difficult for the Republicans to keep their pledge that the no pre-existing condition exclusion on insurance companies is going to be maintained without some way of guaranteeing people that they can get coverage if they have cancer or heart disease or rheumatoid arthritis. That balancing act, I think, is going to create a lot of problems for the Republicans, especially because the first person who has a pre-existing condition and cannot get chemotherapy is going to present a huge problem for them. The second problem, of course, is affordability and keeping the whole system actually affordable. It's not clear the Republican plans are going to keep health insurance at an affordable rate. And I think that is going to come back to haunt them because they pledged that as a very big attack on Obamacare.
Got to leave it there for tonight. Steve Brill, thank you very much for joining us. And Dr. Emmett.
So we're going to find out what the deal is with smoke and mirrors now that the Republicans have control of the presidency, the House of Representatives, and the Senate. Now they can't blow smoke up our butts as far as not being able to get anything done. So now let's see exactly what they get done. And now let's see how fast they repeal and replace the ACA, also known as Obamacare.